Hi there, Dr. Goldie Jacques-Maynes from Golden Chiropractic in Aptos. I'm going to speak briefly today about treatment plans. It's one of the questions that comes up a lot. People want to know, hey doc, how long is it going to take? When am I going to be better? So I break up my patients into three categories. I have patients who come to see me who have an acute problem. We have patients who have kind of more chronic issues, and I have patients that see me more for lifestyle and wellness. So I'm going to talk about those three different categories. Acute patients are coming to me probably for something like an acute low back pain, neck pain. You know, I woke up this morning and I can't move my neck. Maybe there was a trauma, you were just in a car accident, or maybe, you know, your kid was sliding into home base and tweaked their back and is hurting. So again, acute pain like neck pain, low back pain, trauma, or an accident. These patients are going to be seen about 2 to 3 times a week, depending on how bad their injury is, and I'm going to see them about 2 to 3 times a week for about 2 weeks. I feel as a chiropractor that if you're in acute pain, my job is to get you out of pain and back into life as quickly as possible, and if after 4 to 6 visits you're not that much better, I'm probably not going to be able to help you that much that quickly, and I want to find out who can help you better. We'll look at other options of who I can refer you to, your primary care doctor, your acupuncture, PT, etc. Another category of patients that I treat are people with more chronic issues. So this could be somebody who has sits at a desk, has a desk job, and has chronic low back pain from bad posture, poor ergonomics. Maybe you have some arthritis in your neck or in your back, and that causes some flare-ups from time to time. That could be sort of a more chronic issue, a recurrent issue, if you will. Or maybe you've had an old injury. So all the time I get patients that tell me, I was in a car accident when I was 19, or, I hurt my back playing sport when I was in high school, and, ever since then, my back flares up from time to time. This kind of a patient, these sort of more chronic issues respond really well to regular care. Now, regular care can be something really different to each patient, so I can't speak specifically, but generally, these people come regularly. So that could be once a week, that could be once a month, it could be every other week. That's sort of how I generally will start more often and then start spreading out your visits. If you flare up, then we might spread your visits a little bit sooner, and that's how I deal with kind of those chronic issues. I also have another category of patients that come for just wellness and lifestyle patients. So these are people who come in once a month just to get their spine checked, right? Chiropractic philosophy is such that we believe that when we remove nerve interference, your body can function optimally. And so these people might not have an acute issue or even really a chronic issue, but they understand that health and wellness comes from within, inside out, and we adjust them regularly. Sometimes they come and they don't get adjusted. Their spines are doing really good. All right, so those are the 3 categories of patients that I typically see, and how I address treatment plans for those patients. Happy Friday. Hope you guys have a great weekend, and I'll see you next time.